Please share with me your first, last name, where you're located, and the name of your business and or company.
Hi, my name is Dr. Nigel Brayer. I'm from Cleveland, Ohio region, and my company is myself, and I'm the founder of the Ironclad Bladder Retraining System.
Nice.
Yeah,
Ironclad Bladder Retraining System.
yeah,
Tell me more about it, doctor.
sure. So I've been in practice in the wellness space now for 28 years or so. Exciting stuff. So over the years, I've evolved from treating musculoskeletal problems to digestive issues. And the last several years, I kind of stumbled upon, by accident, shall we say, but there's really no accidents, but um, stumbled upon the epidemic really that or that women are suffering from, which is urinary incontinence. So I kind of stumbled upon it in a way such that my wife, with our last child, she started having it. And of course, I didn't know that. She was afraid to share it. But through, I guess, constant annoyance from me, I kind of got to the bottom of, well, why are you avoiding so many of the activities we used to do? Why are you not hiking with us? Why all these different things? And, and obviously an emotional moment, she shared that she was unable to hold her bladder. So I guess being a doctor and being a male, I guess we like to fix things. So I took it upon myself to try to figure out, well, how do I get my wife back to doing what she loves, and then also helping to remove some of the stigma that was associated with it. So I started digging into my old patient files and started reviewing some paperwork from my past female patients, ones who had children and ones who didn't. And I realized from their intake paperwork that urinary incontinence is really a huge problem that had never really been addressed. And so as things went along, I started doing trial and error, different types of things to see if I could help my wife. We went through Kegel exercises. I referred her to a pelvic floor physical therapist, all these different things, and really didn't help her. It did slightly, but nothing really, shall we say, resolved the issue. So I looked a little deeper and did a lot more research in anatomy and physiology and neurology, and I came to the conclusion that the reason urinary incontinence isn't being resolved is because the focus has been primarily on the muscles and tissues around the bladder. And as I started changing my process and helping her and addressing more what's called the neurologic components, and most importantly, the autonomic components, which involves what's called the sympathetic and parasympathetic nervous system retraining, that's where we started to get amazing results. So with her, we started devising the protocol. It worked amazingly. And then I started asking more of my patients who had these problems that I wasn't really addressing prior. And I said, hey, I've got this new protocol that we're testing out. Would you be open to it? And of course, the answer was yes. And 8 to 10 out of 10 women had full resolution. And so I'm like, wow, this is pretty amazing. And then I started looking even deeper and saying, well, why don't women talk to other doctors about this? And I realized that there's this huge stigma attached to urinary incontinence, a stigma of self-worth, of insecurity, of smelling like urine, like all these different things you could imagine. And I realized, well, the majority of women don't, because of all of the different emotional challenges that go with that, shall I say, label. So I kind of take it upon myself to break through that label so that we can open up the dialogue, and help people understand that there's valid solutions, and they're easy, they're non-surgical, they're non-medication based, but it just takes a little bit of retraining, which is what my system was designed for. And I did it in my office for several years, but then I thought, okay, how do I get it to women? Because I understand that a lot of women aren't going to want to talk to others about it, and they're not going to want to talk to their doctors. And even if they do, their doctors are probably going to use this standard treatment. Let's use some medication, let's use a diuretic, let's use a beta blocker. These are different drugs that people use. And obviously those aren't very attractive. So I wanted to make it easy and simple that they could really do it at home. And that's where the Ironclad Bladder System came, because then it's not I have to have the uncomfortable conversations. I have to spend the money seeing a doctor. I have to spend the money getting tests, all these different things that are barriers. I thought if I could remove those barriers, then it would be a lot easier to resolve it, and then also to get people, control of their bladder back.
Yeah, yeah. I guess, doctor, speaking from a woman's perspective, I
Sure,
must admit we did not. There's two things I'd like to admit as a woman and who's had four children is I
sure,
don't know if we could put a name to it, and I think it was normalized, right? I think it was something that we thought was normal after having a kid because we didn't get any instructions on having the child. We didn't get any after the child, so there was no thought process of like, what is this about? It was like, okay, you open up, you're 10 centimeters, you go back down, and it never really goes back down. That's our mindset, right? And then when we normalize things, it's interesting how we don't have a conversation of what we believe to be normal, you know? And so for you to bring this up and to have this discussion, I think is very awesome. And I guess I could probably say for most women that are watching this, or some, we didn't know what to call it. Also, the thought process of urinary incontinence came with age. Okay, I'm 46. I would not admit, you know what I mean? Because I'm not old. You know what I mean? I'm not
sure,
there yet. I
sure.
don't want to. I don't want to be prescribed a diaper.
Hmm.
So at that point, I guess I'm just sharing with you the mindset that I had. I can really speak for myself. So I really appreciate you looking further into that. That's very awesome.
What I find really interesting in what you just said is I've I've spoke to countless women, and they have that exact same sentiment in different words. And so the question is when we normalize things, we therefore sweep it underneath the rug. And then of course we don't ever look at it, and it just sits and festers, and it affects us in other ways. So just an interesting standpoint is, if I always like to see what's on television commercials, because it kind of shows you where problems of people are. And if you notice, next time you watch a television show, is the adult diaper business is astronomical.
Mhm.
How many commercials, how much monthly payment people are spending every single month to not fix anything, but just to normalize it. Like, oh, I guess now I have to put $200 a month in my budget for adult diapers.
Yes.
Isn't that a sad state,
Yeah.
right?
Yes. And for that's the solution, right? That's my thought process is like, oh, that's the solution. There's
Hmm.
no solution to saying, hey, is there something, up here rather than, on the in the lower body or the pelvic area? And of course, Kegels are often stated, hey, that's what you start, that's what you do.
Sure.
Um, Not really sure if it really fixed anything, but hey, we'll try, right? So at the end of the day, as like you mentioned, when those commercials come on, that's typically a woman's solution. And now we can go and do jumping jacks and run and ride the bike
Sure.
and do all those things, but looking like we have a diaper on.
Yeah.
They've been making them thinner now, Dr. Breyer. I'm like, what? I think I'd just rather use a restroom on myself rather than wear a diaper, at the
Yeah.
age of 46. I have a question for you. What
Sure.
Because of this, right? This urinary incontinence. What made someone just say, just forget it? And I mean, and just your thought process, right? Because my mind is going, what was the thought process of someone just saying, just put a diaper on them? And why did they put it in an age rather than someone that did have a child, or rather than someone who is younger that doesn't understand?
So, in my reasoning, and again, I've had the pleasure of meeting a lot of people and hearing their stories, is we have to kind of look at the historical process of healthcare in general. So healthcare in general has a very, very mechanistic point of view, meaning here's your anatomy. This is how it's supposed to work. If it doesn't work, the anatomy's flawed. We move along and do something else. We're going to see if we can manipulate the function of the anatomy using a chemical, which of course is a pharmaceutical of some sort. If we can't manipulate it to what we want, then we're just going to say, hey, it's flawed anatomy. The anatomy can't be changed. Let's move along. But I guess what's really exciting and hopeful, and this is part of my mission, is if I help people understand their anatomy, it opens up the entire door and the whole world of options to resolve it. So let's just talk about that for a second. Is most people might know this, but we have two kidneys on either side of our back, just behind our ribs. And there's two tubes that come out of the kidneys that are called the ureters that go to the bladder, and the bladder is like a balloon. Okay. And then that balloon holds urine, of course, and that balloon is complicated. There's a bunch of muscles that control that balloon. But for simplicity, then there's a straw that comes out of it. And that straw would be called the urethra. Now in men, there's two valves. There's one right where the straw meets the balloon. Okay, it's called the internal sphincter. And on the other end of the straw, called the external sphincter. So there's two with a space in between in the prostate. And in women, they have a very small straw. And so that valve is about an inch long. But what really opened my eyes, because I was trained in medical school like everyone else. You got the anatomy, you got the function, you got the valve, you got nerves that run the valve, big deal, move along. Well, when you look at the valve, and this is kind of where the solution started to percolate, is the innervation, which means the nerve supply to that valve, is only 30% what's called consciously controlled. So what that means to you and I is your bicep muscle on your arm. When you want to flex your muscle, you do it consciously, right? If you're not consciously doing it, unless there's something wrong, it's going to just be at rest. Well, what's interesting about the valve of the bladder, 30% is consciously controlled. So when you're doing Kegels, you are using the 30% to control that muscle. Okay. Well, what about the other 70? And that's kind of where I started to scratch my head and look deeper into neurology. Well, the other 70 is what's called autonomically controlled. So what that means is you and I are sitting here, and if we get excited, our heartbeat goes up. You didn't ask it to, it just did, because you needed more blood for your brain and you're getting excited, so you move your body around. Well, that's autonomically, that's back brain stuff. Okay. Well, that means autonomically back brain stuff is controlling your valve. So I think of it this way: is imagine your fist with a straw going through it, and the tighter you hold that straw, that collapses it and it stops the flow of water, let's say. Okay. But imagine now you're contracting it for days and months and years. Just think about how tight and rigid and stiff your fist becomes, right? So after you do it for a while, it starts to quiver. So a good example is a lady goes to bend over and she, leaks a little bit. Well, when that valve is constantly under a state of contraction, it loses its ability to relax and contract as it should properly. Well, that's an autonomic issue based upon what's called the sympathetic and parasympathetic nervous system, meaning when your body's under stress from having baby, from raising baby, from working full time to juggling 50 schedules, that stress that affects every other part of your life is also affecting your valve. And that's affecting your body's ability to control urine. So kind of the key to changing that is resetting what's called the parasympathetic sympathetic balance, which goes back to stress. So if we can retrain the stress response and then over time help you reduce that stress response, not to stop living and go sit on a mountain and hum, right? But so your life isn't so sympathetically stress, fight, flight, then the bladder starts to gain better control. Now, tissue changes too. There's hormones, right? Hormones shift, they change tissue. So if you address those factors, then that bladder starts to function properly. And even when it's full, even if there's more pressure on it, you have control over it. Does that make sense?
Yes, yes, yes. And so it's very interesting. I was typing these things down. So it's the autonomic, which is the 70%, right? Which is what holds on, right? Because it grips, and it's the straw. I'm thinking of the straw, and it grips.
Yep.
And as we are parenting, all the roles that we fulfill as women, it's often tight, right? It's often controlled, right? Not by us, but because it's controlled. But then you said when we get excited and our heart rate goes up, I think that it sort of loosens up. Well, that in my mind, I'm thinking that's why when we do something fun, everything just happens, right? It's not doing it while we're chasing the kids or, we're cleaning the kitchen or we're doing anything else. And so I guess I'm having this aha moment in realizing that the stress that we have as women and the lifestyles that we live in, not like that's, it's always bad stress. It's just all the roles that we play. But
Sure.
then the minute that we decide to have fun and the minute that we're like free, everything's too free, doctor. Like, wait a minute. What we're paying for to do now, our body is taking full control. But it's almost like, for lack of better words, like our body is just releasing. Like, it's like, oh, okay, we're in a different environment. We don't have to tense up. We can let loose. But doctor, as a woman, I'm irritated to hear this because we have enough stuff just being a woman, you know what I
Sure.
mean? Trying to
Yeah.
control the emotions and the hormones, and not to mention as we get older, not to mention having babies and everything else. I think that we tend to lose less control over things. And now we have to figure out how to do something else in order to maintain a normal lifestyle. That's challenging.
It is. And I guess just to take a little of the angst out of your voice with that, because you feel like, oh my, another thing I have to add on to my
Yeah.
to-do list. This is just, it sucks already, right? So,
Yeah.
so the solutions are simpler than you think. And I'll just use a different example.
Okay.
Is sympathetic, let's just kind of take a step back from this topic for a second, and let's just talk about heart disease. Heart disease is the number one cause of death in most first world nations. What is heart disease? It's what's called a sympathetic dominant disease. What does that mean? It means that after years of this fight flight response, you and
Mm-hmm.
I have just been talking about the bladder and the valves called sphincters. What about the blood vessels?
Mm-hmm. Mm-hmm.
Well, they're doing the same thing. So now imagine your blood vessels are constantly constricting over decades, and now your heart rate has to go up and your heart load has to go up. That's
Mm-hmm.
what causes heart disease. So we're not talking about anything different than undoing how we've responded internally to stressors.
Yeah.
The only difference is, and this is what, again, this protocol is about, is our focal point, and I call it our $1 million problem. The $1 million problem is you can't hold your bladder. So let's fix that first. And to fix that, we have to address the underlying stress that, oh, by the way, is also going to create heart disease later in life. So it's not like you got to do a whole bunch of different stuff for different problems. This is just a different symptom related to one underlying problem. So resetting the sympathetic nervous system, and more than anything, making a small, simple, consistent effort to do so. And that's, again, I'm not trying to sell a program, but that's what the program is designed for, is how do I implement something simple? Because like you, Javenka, is we don't want another overwhelming thing that people have to try to fit into an overwhelming life. We want to give solutions that are simple, where it becomes like, I really look forward to this
Yeah. Yeah.
process that I'm learning. That's not only going to help my bladder, which it absolutely will, but it's going to help my life. It's going to
Yes.
help how I relate to my children, how I relate to my coworkers, my significant others, all that other stuff.
Yeah.
So it's
Yeah.
not like 10 different things I got to do. It's one or two things that are going to affect the whole cascade of your life.
That sounds better.
Kind of cool. Yeah.
That
So,
sounds better.
yeah. And that's the cool part, is when you start making those changes, it'll start affecting bladder, yes. It'll start affecting how you do things, yes, but it'll also affect how you sleep. It'll affect how you respond to others. If
Yeah.
you're already wired and stressed, then of course when others bring more things to you, you're more wired and more stressed, and that affects all those interactions, and it becomes like a big, it just builds.
Absolutely.
Yeah.
And it's actually really nice to talk about this, and I'm super excited for those who choose to watch this, because at the end of the day there's something else that we can learn. And as I mentioned to you before, I feel like I'm the audience most of the time as I continue to have these conversations. And for me, Dr. Breyer, I know what your vision is, but tell me about your vision with this foundation.
Sure. So really simply is open the dialogue,
Mhm.
and then the biggest thing is getting an understanding of your body. So that's kind of my mission. The protocol is the how.
Mhm.
The mission is let's help people, women in particular, of course, first understand a little bit about their anatomy. Because
Hmm.
if you understand how your body works, you make entirely different choices. Again, I've been at this long enough to see patients make enormously erroneous choices or following choices that other doctors that say have made, but they just didn't make any sense. But they didn't make sense because the patient doesn't understand how their body works. So if I can help people understand their anatomy, their physiology, and you don't have to be a doctor, just enough to, make good decisions, and then give them steps to start to improve how that all integrate, they first are going to get a resolution or a great improvement to their $1 million problem,
Yeah.
but it's going to empower them so that they can start doing what they love. Because you think about how, and I've heard this from countless women, their lives become extremely small.
Hmm.
So we talked about the occasional leak. That's one issue that you can temporarily use a pad, etc. But now imagine how it progresses to where you can only hold the bladder for, let's say, 10 minutes, and you
Hmm.
got to go to the grocery store, and you're worried about smelling in urine. Do you see how your life gets really small as that builds? So I guess
Absolutely.
my big vision is empower women with some understanding, give them tools that not only will help their current problem, but will help them live just more stress free, more authentically, have better relationships, have better interactions with their kids, their family, their life. So that's really my big vision.
I love that. I love that. And I do have just one more random question.
Sure.
What does it feel like having this conversation and being a man?
Sure. I'm glad you asked that because I get that one a lot.
Mhm.
And I didn't choose this. And so it's not like I, had this premonition from God that this is going to be my mission.
Yeah.
It's mostly like, and I'll just speak spiritually for a second, is most things that have created the biggest impact that I've been able to help others are problems that appeared to me that I felt a deep need to figure out and solve. And
Mhm.
again, is maybe that's a man thing because we like to fix stuff. I'm not sure. But, and my wife and I talk about this frequently is you're a guy and you're talking about female urinary incontinence. Isn't that a barrier? And I guess the question is, it might be to some,
Mhm.
but my thought is knowledge starts to soften that edge.
Mhm.
So I don't come to people and say, hey, I can fix XYZ. I come to people saying, hey, let's take a look at this together. And let's look at how all these things work together. And let's kind of have a dialogue. And
Absolutely.
I can't truly feel how you feel.
Yeah.
I can never be a woman. I treat many women, and of course, I'm a husband, but I can't be a woman.
Yeah.
But that also gives me the advantage of to be able to empathize, but not actually have to live your pain. I can empathize as a male, but I can also keep a little bit of a logical perspective saying, if we do this, then we can do this without being drug into the weeds. Not that I'm not emotional, so I'm not going to say that, but men and women have their strengths and weaknesses. I think one of the male strengths is they can kind of, my wife calls it, men are waffles and women are spaghetti. So men can put everything in a little square box and work on the box, and then when they need to work on something else, they step out of the box and go into another one. She said women are spaghetti, all the little strands intertwined together, and that's the way they think. And I try to keep that in mind. So part of me thinking squarely, a
Yes.
waffle, allows me to really focus on this problem and then offer solutions without intertangling it to all the other things, which can often happen.
Yeah.
Does that
And
make sense?
yes, yes, because I guess if you have in the analogy of your wife, two spaghettis, all we're going to do is just entangle the even more. So I like that. I like the analogy of having spaghetti and waffles because number one, there won't cross at all. Number two, they're two big different things. But I love that she said that because I that brought me a lot of understanding too as well. And I know the audience would be again have an aha moment. Thank you so much, Dr. Brayer, for choosing to do this, right? Yeah, I know you've been given a vision to do this, but it's also a choice to want to do this and then create a foundation and a system to helping women with urinary incontinence. Thank you so much. If it's okay, would you mind sharing a website or your social media handles for the audience?
Sure. My website is Dr. Dr. Nigel, Nigelbrayer, .com. And on there, you can learn all sorts of cool stuff. We have April 17th, we have a really exciting live webinar coming up for ladies. It's free. We'll learn a lot deeper dive into these sort of things. We'll talk a lot about hormones. We'll talk about stress management, things you can do at home. We'll talk about some of the specifics of the protocol. So people are welcome to sign up. I think we have a waiting list for that sign up. So we'd love for you to join us.
Thank you for being here today. I'm really happy that you tuned in to Vision Pros Live. I'm looking forward to seeing your reactions as these episodes continue to move forward. This is going to get more and more fun. We'll have more and more engagement as well. We'll invite people to participate in the show. And thank you for giving us your time and attention. Have an excellent time building out your vision and becoming a Vision Pro yourself.